Many NCLEX candidates have said that the heart is one of the major systems or organs to understand, the cardiovascular system. And so we look at the center of the cardiovascular system, we have the heart, which is a muscular organ. It is a pump that pumps blood, which contains nutrients throughout our body, right? Our bodies. And so we know that it receives deoxygenated blood that comes through to be clean. It comes through the heart and passes through the lungs and goes out clean or full of oxygen to the rest of the body. We know that the heart has a starting point, the sinoatrial node, that chemical activity that flows through the heart, right? They'll allow it to pump the way it needs to. So we also know that it pumps through highways, right? Blood vessels. And anytime there is a blockage, when you think about the highway, when there's a blockage, things slow down and can have increase the chances of things backing up along the streets or the highways. We know that the heart receives its own supply through the coronary arteries. And we also know that when those are blocked, the heart doesn't get enough oxygen that it needs, angina, right? Hypertension, when the clogging of the highways occur, if you will. And arrhythmias, when these are problems that can happen, right? We know what's normal, and we know what's abnormal. Abnormal things can happen. And when there is the chemical activity through the heart is not flowing through, they can have what you call arrhythmias, and that can affect how the heart pumps. It could become to a point that it's an ineffective pump, heart failure. So we know if we understand the basics of the heart, just some key things, and we understand that when the heart isn't working naturally or normally, we have abnormalities, right? What we call abnormalities. And we know ultimately the goal is what? To return the heart to its natural function and structure, because we know if it's out of structure over time with increased blood pressure, tachycardia, arrhythmias, it can grow in different shapes, and that can affect the way that it pumps blood to the body, right? And so when we understand that, we know the ultimate goal is to return it to normal as much as possible to its functional status. And that's where you have ARBs, angiotensin receptor blockers, and ACE inhibitors that help with hypertension and vasodilation. Calcium channel blockers, DIG, helping it to be a more effective pump by it being a positive inotropic drug, inotropic meaning contraction. There are other medications, Lasix, that can help clear the highways, flush out the cars. They can flush it out, right? We have our statin drugs that help to decrease all the mud and grime that can get in the highways and block them up, right? And so understanding the basics, sometimes we make things harder than what they are. And if we understand the basics and then move to the basics to, okay, what can happen to the heart? Now we're going to try to return it to its natural state. And in the meantime, there are things, nursing considerations that I need to watch for. I'll talk to you guys soon. Take care of yourself. This is a Monday tip. And do know the NCLEX Success Mindset course is out there, as well as other resources, study guides that I have on my Teachable page, which is Fulfill Your Divine Purpose Academy. I'll talk to you guys soon. Take care of yourself. Have a fantastic week. And listen tomorrow as I'll do a sample question. Talk to you soon.